So here's your Intralipid rescue box. This is your Intralipid bag. This is your vented tubing. Inside the box should also have an 18 gauge needle, two 18 gauge needles, and then two 50 ml blower lock syringes with alcohol swabs. The first step is to start a bolus on a patient that needs the lipid emulsion. So over 70 kilos and under 70 kilos is the same dosage. So a bolus is going to be 100 milliliters over 2 to 3 minutes. And then you would do an infusion of 250 mils over 15 to 20 minutes. So we're going to open our vented tubing and spike the bag. Be sure to open that the tubing. So we'll prime it, and then we're going to pull up a 50 ml syringe of the lipids. And then you're going to pull up a second syringe to make a total of 100. And that will be your bolus. You can use the 18 gauge needle to pull up from that green port, but it comes up pretty fast and it does leak. So this might be an easier method. So then you would administer those two syringes to the patient over 2 to 3 minutes. So that would be a bolus. And then we'll initiate our infusion. And select any critical care environment. ICU is fine. And then we'll do IV fluids. There's no settings for lipids or Intralipids, so we'll do fluids. So we'll have the rate of 750. Volume to be infused is 250, and that'll be given over 20 minutes. Okay, and then we run it on our patient. You can repeat the infusion if the patient is still unstable. The max dose for lipids, the max dose of lipids, I believe is 12 mils per kilos. So keep that in mind. So it's going in pretty fast here. But again, this is your bolus infusion. You're trying to fix the effects of the toxicity.